Hello everyone, welcome back to my channel. Today we are going to discuss another interesting entity which is called Discitis Osteomyelitis, or basically infection in the spinal column, how we diagnose infection or Discitis Osteomyelitis in spine MRI. So let's go through this imaging. So patient presenting with back pain, this is one of the important or essential diagnoses that we shouldn't miss, and we should make sure we just find the accurate findings, and then all the important findings we should just pertinent positive and pertinent negative that we have to discuss to our referring physicians in our reports in order to take care of the patient in the best way. So this is a T2 sequence, and the way I know, I just repeated this several times, but I know repetition make perfection. So you just need to hear this several times. This is a skin, and as you see, the skin is going to be T2 bright because of fat, and then we see that there is a CSF in the spinal canal, which is again bright because basically fluid is going to be T2 bright on the spine on the T2 sequence. So basically, so this is a T2 sequence, and just for the second, just we ignore everything else. We're just going to focus at the L4 or 5 level because this is the area that we want to discuss. So if you look at the L4 or 5 level, you see that these end plates, they are just having a lot of irregularity and some sort of like destructive changes at the end plates. And we see that if you compare other end plate levels and other discs, if you see this, all of them are like T2 dark, but this specific one is T2 bright. So remember that we have these destructive changes at end plates, and this specific disc is just T2 bright. So what sequence is this one? Is going to be T1 bright, and again, the way I know, because all these in adult patients that they don't have any diseases, any anemia, any like underlying cancer, we are just going to have a regular fat marrow in our bone marrow, so that's why it looks bright. So this is T1 bright. As you see, this is a normal bone marrow appearance, and then you see again the subcutaneous fat is going to be T1 bright, and then you see that the spinal canal, the CSF fluid is going to be dark on T1. So this is T1 sequence. And again, we're just going to focus on that level that I just discussed at the T45 level. As you guys see, there is a marrow replacing process that is happening. That is, the whole L4 level looks like pretty much dark. Like there are some areas here left, but most of this looks like very dark. And also T5 level also looks like very dark. And then it's just spreading to the disc space as well. If you look closely, you see that is all fat that is in the prevertebral soft tissues. They are all bright, but you see that this fat over here, if we just show you right there, you see that these areas, let me show it to you closely, these areas, you see this all dark. So this is, there's some sort of stuff happening at the prevertebral soft tissues here, and then you see that we are just losing those signals related to fat. And again, if we look at the spinal canal posteriorly, we see that there's some stuff also in the posterior aspect of the disc in the epidural space right there. So this area, you see that there are some like sort of epidural disease involvement here. We're going to discuss on other sequences as well. So far I know there is some sort of processes going on at the level of L4 or 5. So this is a money sequence in a spine imaging on MRI. This is a stir sequence when we just suppress fat, and then everything else is just going to be bright. So you see that the spinal canal, the CSF is going to be T2 bright, and again a stir bright, and then everything else in the sub-Q fat is just going to be dark because this is a fat saturated sequence basically. If you look at this L4 and 5 level, you see that the marrow replacing process, which is basically edema. When we have infection, you're just going to have edema in the marrow. As you see that this is L4 and 5 vertebral bodies are completely bright because of edema and inflammation going on. It also extends into the disc space, which is also bright. And also you see that all the stuff I showed you on T1 now is just also T2 bright. You see that there is a prevertebral soft tissue swelling edema. And these are like normal appearance, nothing is going on, but here there is just prevertebral soft tissue edema and enhancement, and you're going to see it on a post-contrast sequence. And if I look closely, do the stuff I showed you on T1 again showing up on this third sequence, we have some sort of epidural involvement as well. So this is the epidural phlegmon or epidural abscess formation in the setting of Discitis Osteomyelitis when it's getting like chronic and it's getting untreated. Also right there as well. Okay, so far we know that there is Discitis Osteomyelitis going on at L4 or 5 level, and if you look at this is a T1 post-contrast fat SAT, and the way I know, again, you see that this subcutaneous fat is just going to be very dark, but now I have enhancement because this is the aorta and also vessels in the abdomen that they are all bright, and then you see that the CSF is dark as well. So there is nothing going on in the spinal canal. There is no abnormal enhancement in the cord or leptomeningeal through the caudal nerve roots, but you know that there is avidly enhancing areas in the L4 and L5 vertebral bodies extending to the disc space. We have a lot of perivertebral soft tissue edema enhancement, phlegmon formation, and then we have this epidural enhancement, as you see in the posterior aspects of the L4 and L5. And if you just look closely, this is also involving the norepinephrine. So the important or pertinent positive things we have to discuss. First of all, we have to say if this is a Discitis Osteomyelitis or not, which is basically it is. And the main differential is just like modic type changes or basically degenerative inflammatory changes, but this is very different. And the way it is different is when you have infection and you have discitis, you have like your infection or inflammation going beyond the osseous structure. So you have extra osseous involvement. As you see here, we have like extra osseous involvement of the soft tissues in the perivertebral soft tissue, and you have epidural involvement. That it says by itself that this is not a simple degenerative changes and it's just something beyond. And if you look at this one, this is the actual sequence. If you go to that respective level, you see that this extensive enhancement that is going extra osseous. You see that we have early abscess formation in the psoas muscles here. So basically extra osseous involvement of the soft tissue and muscles, paraspinal musculature, and these are psoas muscles. And also we have epidural enhancement. As you see, this is the epidural involvement at this level. This is how it should look like. This is a normal, the level above, and this is abnormal in the level of the disease. So we have epidural involvement, and that's another important thing that is differentiate this entity from regular modic type changes or inflammation. It's not going to go through the epidural surfaces, or it's not going to go to the extra osseous structures within paraspinal or soft tissue. So this is very important distinction that you guys should know how to differentiate modic type changes from Discitis Osteomyelitis. Okay, so this is one thing. We have to make sure that we are just doing a correct diagnosis. This is Discitis Osteomyelitis. The second thing I have to tell my referring physicians is, do we have any pathologic fracture? Do we have any retropulsion in the spinal canal? In this case, we have some destructive end plate changes, but it doesn't have that much pathologic fracture at this point. It doesn't like protruding or retropulsing into the spinal canal, so it's fine for that feature. And the other thing which is very important, as I said, the extra osseous involvement. This abscess formation in the psoas muscles is very important. We have to report involvement of the foramens with infectious process like here is very important, and also epidural involvement is very important. We have to talk about these entities. So overall, very important and very urgent diagnosis we have to be able to make on MRI. And the money sequences you guys need to look is this sequence, a STAR sequence, that is just any abnormality is just going to be very bright. And then post-contrast sequence is very important. And like so many of these patients, they are sick, they are like ICU patients. Sometimes they cannot like stay in the scanner for a long time, and sometimes you just get very limited sequence. They are not going to be post-contrast. So don't worry about it. If you just have one sequence, which is this one, you're just going to be able to make the diagnosis, because as you see, I see everything. I see perivertebral soft tissue edema, I see the epidural involvement, and I see the disc involvement, all irregularity of the end plate. So I just need this one sequence to make the diagnosis actually. But these other ones are like just support my diagnosis. As you see, this is the post-contrast sequence, and this is the actual T2. As I said, these patients are very sick. They're just so much motion degradation through these imaging, but we're just doing our best, use all these tools. But you see that this epidural involvement right there on this T2 sequence. Okay, so very important diagnosis. Make sure you understand all these essential MRI sequences. You just get familiar with your specifically like junior resident. Make sure familiar with your STAR sequence, post-contrast T1 sequence, and then what are the important findings in Discitis Osteomyelitis you should report to your referring clinicians. Thank you everyone, and if you like this video, please don't forget to subscribe and follow me on this journey. I'll see you on the next video. Thank you.